North.
Madam Speaker, Gillian Wagner was failed by our healthcare system. She waited 13 months for a breast cancer diagnosis. Her referral was lost. She was dismissed because she was apparently too young for breast cancer. She had worrying symptoms and still couldn't get answers, and she's not alone. Why is this government allowing women and gender-diverse Nova Scotians to be ignored and fall through the cracks of our healthcare system?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker, and certainly I can't speak to the specifics of any individual person's experience. We do want Nova Scotians to feel that the healthcare system is there when they need it. The Nova Scotia Breast Screening Program meets and exceeds national targets. Again, I can't speak to specifics, but we do work very closely with that program. We make sure, I recently met with Nova Scotia Breast Screening Program to make sure that there's being nothing held back, that we are continuing to meet national screening guidelines, and certainly I would encourage the members opposite to make the same appointment with the lead of the Nova Scotia Breast Screening program to get information directly from Dr. Shaw Niles. She's an incredible resource, and I think it would be very helpful for the caucus to hear directly from her.
I recognize the Honourable Member for Dartmouth North.
Madam Speaker, people like Gillian are falling through the cracks because of various reasons. And so to say that a thing is working when it's clearly not working for this person is difficult to hear. We're hearing more and more stories like Gillian's of women and gender-diverse Nova Scotians waiting. They're unable to get screenings. They're unable to get diagnoses. They're unable to get care. They're being dismissed because of their gender and sometimes because of their age. And they're getting sicker while they just fight to be heard. These are not one-off cases. This is becoming a pattern. We need a women's health strategy, and we needed it yesterday. So why does this government still think that a women's health strategy isn't necessary?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. And certainly we haven't said that it's not necessary. What we've said is right now we are fundamentally investing in the things that are required in order to have a base for women across this province. We've been investing not only in healthcare in terms of workforce, which is really an essential component. It takes some time to train individuals, but also in the technology that's required to perform some of these diagnostic tests. So we are working very hard with IWK, with experts, with regional specialists in order to make sure we have integrated care across this province. We'll continue to do that and make the investments. And I said, in future we may consider a women's health strategy, just not right now.